So first topic that we are going to study is the basic lesion, primary lesions and secondary lesions that we see in primary and secondary lesions. Okay. Now, to identify, to diagnose what are primary lesions, what are secondary lesions, you should know how these lesions looks, how this lesion appear when manifested clinically, right? So when patient comes to you and you do all the OPD, you take chief complaint, you take history, you do clinical examination. So clinical examination is very important step in your diagnostic sequence, right? So during clinical examination, you need to identify whatever changes that have happened in the oral mucous membrane, right? So, first of all, you need to understand what is lesion. Lesion is the visible change in the mucosa, in the mucosa. So, lesion is originally, you can write it down as a visible change in any normal anatomical structure. But here we are looking at oral mucous membrane. So we'll write what is lesion, visible change in the normal anatomical structure. For example, oral mucous membrane. Okay. Now, what are primary lesions? What are secondary lesions that you need to understand? What are primary lesions and what are secondary lesions? What are primary lesions? They are first pathological lesions which are manifested clinically. Which are manifested clinically means this is the first lesion that will appear. Okay, that is called as primary lesion. What is secondary lesion? Secondary lesion is just altered primary lesion. Now, if your primary lesion is vesicle, for example, this vesicle will rupture and form ulcer. So, ulcer becomes your secondary lesion. So, secondary lesion is nothing but altered primary lesion. All right. So, these are two types of lesions that we are going to be looking at. Okay. All right. Now, first primary lesions that we have, the first primary lesion that we have is a vesicle. Now, vesicle and bulla, you need to understand the difference between two. Vesicle is filled blister. Bulla is a fluid filled blister. What is the difference? There's just the size difference. Okay. So, your vesicle, okay. So, your vesicle, just 2 minutes. Okay. Yeah. So we have vesicle. Your vesicle is a fluid filled blister, but difference between the size of vesicle and bulla. Vesicle ka size is less than 1 centimeter in diameter. Okay. And if you compare it with the bulla, the next one is the bulla. Bulla is also a fluid filled blister, but the size is more than 1 centimeter in diameter. More than 1 centimeter in diameter. So, vesicle, you will be seeing this vesicle in, say, HSV infection. You can see this vesicle in herpes zoster infection. Okay, there are many more, but just to give example here, okay, vesicle will be seen in HSV infection, in herpes zoster infection. Bulla is also a fluid filled blister, but greater than 1 centimeter. And the example, bullous lesion or bulla will be seen in pemphigoid. Pemphigoid. Okay, just remember this much. Next primary lesion that we have is the pustule. Now, pustule also resembles like a bulla and vesicle, but what is the different difference between the pustule and the vesicle is this is also fluid field, but which fluid? Purulent fluid. Purulent fluid. Purulent fluid, or you can call it as a pus. Okay, so this is also circumscribed elevated lesion. Elevated lesion. Circumscribed elevated lesion, but what it contains? It contains purulent fluid or pus. Okay, what is the example of it? Chicken pox. Chicken pox may you see primary lesion as a pustule. Okay, let's move on to the next, which is papule. Now what is papule here? Papule is a solid lesion. Okay, so this is elevated solid, elevated solid lesion. Okay, it do not contain any fluid field or any pus, nothing, just a solid elevated lesion. Okay, and which will be less than 1 centimeter in diameter. Okay, or in size. Okay, it is less than 1 centimeter. Okay, example of papule, you will see this in lichen planus. You will see this in lichen planus. Okay, all right. Next one that we have is nothing but plaque. Okay, plaque. Plaque is also slightly raised area. Okay, as you can see over here, white raised area. Okay, and you can see the demarcation. Okay, the difference between normal mucosa and this lesion. So we'll call it as a raised area or demarcated area. Demarcated area. Okay, and it will have a gray to white discoloration. Gray to white discoloration. This is also a raised lesion. And what is the example of plaque? You can see this in leukoplakia. You can see this in leukoplakia. All right. Next one that we have is a macule. Macule is also a primary lesion. Macule. Macule is a flat area of discoloration. It is not raised, it is not fluid filled, nothing like that. Macule is just a flat area of discoloration. Flat area of discoloration. Okay, macular pigmentation. Okay, in oral pigmentation we are going to study about aphylis or melanotic macule. Okay, macule is a flat area of discoloration. So here, as you can see, this is just a small area of discolored mucosa. All right, next we have are the lesions due to extravasation of blood. Okay, extravasation of blood. We have petechiae, we have petechiae, and we have ecchymosis. Ecchymosis. The cause for the both lesions is same. Petechiae is just a pinhead sized, as you can see over here, 1 to 2 mm discolored spots. And ecchymosis is, you can say, periorbital ecchymosis, or you can say it as a subconjunctival ecchymosis, subconjunctival and periorbital. Okay, so ecchymosis is just a larger area of discoloration. Larger area of discoloration. Okay, petechiae are pinhead sized, ecchymosis is a larger area of discoloration. All right. Okay. Next, we have a primary lesion. We'll see first and then we'll move on to secondary lesions. Nodule. As you can see here, this is nothing but well circumscribed elevated lesion. Well circumscribed elevated lesion from the surface. From the surface. Okay, this is nothing but a nodule. So what example you can take is a fibroma, irritational fibroma. You can take it as an example for nodule. Okay, well circumscribed elevated lesion from the surface. All right. Okay. Next, we'll move on to the secondary lesions. Secondary lesions are nothing but altered primary lesions. So first secondary lesion that we have is the ulcer. Ulcer. Secondary lesions. Okay. What is ulcer? It is breach in continuity. Breach in continuity of skin or mucous membrane. Okay, it is a breach in continuity of skin and mucous membrane, which is ulcer, and the central area or central tissue will undergo molecular death. So, breach in continuity of skin or mucous membrane with molecular death of tissue. Okay, the central area will undergo molecular death. All right, this is ulcer. So, ulcer primary lesions like vesicle or bulla can rupture and give rise to ulcer. So ulcer becomes your secondary lesion. Okay. Second secondary lesion that we have is erosion. Erosion is nothing but the shallow defect in the mucosa. So here you see the atrophy, okay, the red area, okay, and this red area is surrounded by this white stripe, okay. So red area, what you see is nothing but a erosion. Erosion is just a shallow defect in the mucosa, okay, and this shallow defect is due to loss of epithelial coverage. Shallow defect is due to loss of epithelial coverage, okay. Erosion. So, example, you can take it as a erosive lichen planus. Erosion like lichen planus may you see this secondary lesion which is erosion. All right. Hmm. Okay. Now, next secondary lesion that we have is nothing but a crust. Crust. Okay, crust is a third secondary lesion. Crust is nothing but a dried exudate on the skin. Dried exudate on the skin. Okay, so when you have injury on the skin also, or you have on the this keratinized mucosa, so you can take an example of herpes labialis. Herpes labialis, when starts healing, it becomes a crust lesion. Okay, crustaceans, dried exudate. Okay, so crust is nothing but dried exudate on the skin. Okay, and yeah, so this is the third secondary lesion that we have. Fourth secondary lesion is scar. Scar, you all know, scar is nothing but after injury there is excessive collagen deposition. So excessive collagen from uh, not from, it's form. Excessive collagen forms after injury. Okay, excessive collagen forms after injury at the site of the injury. Okay, that is nothing but a scar. So, scar lesion you all have seen, that is also a secondary lesion. So, we need to know this much primary and secondary lesions, okay, to understand further topics. Okay,